Good morning, everybody. My name is Dr. Niru Prasad. My background is pediatrics and emergency medicine. I am affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont Hospital. Today, I have prepared a lecture series for our senior citizens, and the lecture is safety precaution tips for our senior citizens. I have also elaborated on some aspects of bright side of aging that I would like to share with you my talk. As we are growing old, it is very important for all of us to follow some of the guidelines for staying healthy. As we know, health is very important for all of us. With all aspects of aging, it's important to stay in good health. With this in mind, I have prepared some tips and guidelines that all of you can follow in order to stay healthy. My first health safety guidelines includes a healthy way of living. The second one is prevention of diseases by a proper immunizations, followed up by avoid summer-related injuries, recognize the signs of dehydration, heat-related illnesses. How do you plan a good, safe summer vacation? Avoid insects bite, stings, and most important thing is thinking positive about the bright side of aging. Prevention of disease by a proper immunization is very important for all of us in every age group, starting from children, adults, senior citizens. These are the immunization guidelines that everybody should be following for ages 60 and over. Blood cholesterol screening should be done every year. Influenza vaccine is every year, tetanus booster every 5 to 10 years, pneumococcal vaccine 5 years, a regular dental checkup every year, hearing and vision should be checked every year. There should also be a periodic checkup for hypertension, diabetes, and breast examination with a routine mammogram as advised by your physician. A routine pelvic examination is suggested with a pap smear in female, as well prostate checkup in males, and a routine colonoscopy to detect colon cancer. Now, I just want to elaborate a little bit more detail about the immunization guidelines as suggested by CDC, which stands for Current Disease Center Immunizations for 65 years and older. Influenza vaccine every year during the fall and winter, just so that we all know that every year the strain of the virus changes. What virus was prevalent last year, it might not be here this year. So, it is better to get the flu vaccine every year during fall and early winter. Pneumococcal vaccine, 1 to 2 doses at age 65 years and older. Let me tell you something about the pneumococcal vaccine. People who are smokers or who had smoked in the past, they are more susceptible to lung disease, and for them it is suggested that they can get a second dose of pneumococcal vaccine. However, for a general population, one pneumococcal vaccine is good enough for every 5 years or so. Tetanus, diphtheria, and pertussis vaccine. It is very important to know that during childhood everybody gets immunized with the regular 4 injections of diphtheria, tetanus, vaccines as we are getting old. One booster shot is needed every 5 to 10 years, and the booster shot has more tetanus dose than the diphtheria, and it is called TD vaccine. Hepatitis B. Hepatitis comes in two forms, hepatitis A and hepatitis B. If you have a specific risk factors such as exposed to somebody with the hepatitis B, definitely hepatitis vaccine is indicated. Usually the hepatitis vaccine for B virus is given in 3 doses, first and second dose 1 month apart, and the third dose is 6 months. Hepatitis A is a foodborne disease. People who go to other part of the world, third world countries where the food hygiene is not that good, they are supposed to have a hepatitis A vaccine. Measles, mumps and rubella vaccine, that is indicated 1 dose. Varicella vaccine, the chickenpox vaccine, if you never had a chickenpox or received only 1 dose, talk to your health care provider if you need a chickenpox vaccine. Shingle vaccine. Shingle vaccine is also herpes zoster vaccine, and if you are 65 and older or immunocompromised, then it is suggested that you get a shingle vaccine, especially also if you are exposed to somebody with the immunocompromised disease, you are going to visit them. It's better to have an immunity against herpes zoster vaccine. People who are traveling abroad, the United States, outside the United States, it's always better to call the travel immunization services. When you like certain countries need vaccines for cholera, for malaria, and it's always better to get to contact the travel immunization center, and that way you are adequately immunized before you leave the country. Now I am going to talk a few words about how do you protect yourself against the summer related illnesses. During extreme hot and humid weather, we suffer heat illnesses which are due to poor thermoregulatory mechanism as we are getting older. What do? Drink plenty of fluids, including balanced electrolyte solution such as a Gatorade, because sweating can lead to loss of salt and potassium from the body. During the hot, humid weather, it is always better try to stay indoor in air-conditioned facilities or in shaded area. Dress light, loose and layered clothes. This is my very favorite sentence, and it goes for athletes, it goes for golfers or anybody who is in hot weather. Remember 3L, dress light, loose and layered clothes. Wear hats and sunglasses, and that is to protect you against strong sunlight. Avoid drinking carbonated drink and alcohol, because what happens when you drink alcohol during extreme hot weather, there is a dilatation of the capillaries, and when the blood flows through those blood vessels in the distal part of the body, your blood pressure falls down. When the blood pressure falls down, you get dizziness spells. Excess carbonated drinks can also give rise to abdominal cramps. Always, very important, always know the medications you are taking, because there are certain medications such as thyroid pills, hypertensive medications, antihistamines, anti-anxiety pills, and certain antibiotics like tetracycline, and all these have a very adverse effect during hot weather. Tetracyclines causes a photosensitivity reaction in the skin, and it is not indicated while you are in the hot weather. Same thing about a diuretics, thyroid pills, because all these medications can have adverse effect on the body. Recognize the warning symptoms of dehydration, such as dry tongue, dizziness spells, and in order to, and once you recognize those early signs of dehydration, start drinking plenty of fluids, which is very vital for you. Now, there are certain symptoms that are related to the heat exposures, heat cramps, heat syncope, and heat stroke. Heat cramps are usually due to loss of potassium and electrolytes from the body from sweating, and it causes you develop muscle cramps in all over the body. Working at the emergency room, I see that mostly in the athletes who are outdoor, and they come to the emergency room with the muscle cramps. This is due to loss of potassium and electrolytes, and this should be corrected by drinking fruit juice as well electrolytes balanced solution. Heat syncope, like I mentioned before, is a fainting spells due to volume deficit, vasodilatation. So, there is a peripheral pooling of the blood, and it causes a low cardiac output. Heat stroke is a very serious form of heat illness that I am not going to talk more about this to you, because that is a real medical emergency, because with the heat syncope there is dryness of skin, there is fainting spells, and it needs immediate medical care. Recognize the early signs and symptoms of heat syncope, such as cool, moist skin, weak pulse, low blood pressure, and dizziness spells, and try to seek for medical help. Now, how do you stay cool inside your home? First of all, it is very important to protect yourself against strong sunlight. Close the blind, shades, and the drapes, so the hot sunlight does not penetrate inside the room. Always eat light food to avoid indigestion and stomach cramps. A good insulation will keep cool air inside for a longer period. Now, how do you plan your summer vacation? During the summertime, all of us are tempted to go outside. Either we take airlines, fly, or we drive. Here are a few safety precaution tips while you plan your summer vacation. Make sure the hotels and the airlines, they know your personal needs. Notify your travel agents of your health conditions if you are flying, so they are prepared for any medical emergency. It's advisable always carry your medications, immunization cards for your allergies, your physician's contact, as well as for your health insurance cards in your purse or the wallets. Never check in those informations in your suitcase, because you should be prepared to have those informations handy in case if any accidents happen. Before making a hotel reservation, make sure that hotel is equipped with a proper handicapped equipment if anything is needed. Here are a few driving precautions. While you are driving long distance, always first of all maintain a good health. know your limits as to how much driving can you handle without any problem. If your driving skills are impaired due to poor vision, arthritis, or any other disabilities, always ask for help. Lastly, know the details of your car, such as brakes, adequate gasoline, adequate water in the cooler, adjustable steering, and all these things should be done before you start your driving during the summer vacation. Now, the second part of my lecture includes the bright side of aging, and this is a very important lecture for all of us as we are getting old. As all of us are getting older, there is a lot of fear in our mind. We are worried about our health, financial situation, families, job, and other aspects of life regarding our future and destiny. Considering all these facts in mind, I prepared my lecture. Before I did that, I did lot of research, and I was surprised to know how many researchers, scientists have worked on this aspect of medicine, which is the bright side of aging. So, what is it? What are we talking about? This is a documented fact that older adults who have a bright outlook to future, they live longer and happier than those who dwell in negative thoughts. Remember, our life is full of joy, sorrow, failures, and accomplishment. The key to happiness is always to count your blessings, be happy, and never look back, because if you don't look back, you will never see your shadow behind. And this is a very important facts to remember. For us to be healthy, it is very important to eat a well-balanced diet, which is supplemented with the vitamins, minerals, and I did lot of researches about this aspect, about the nutritious food, and there are thousands and thousands of articles about the food, which is hard for me to bring to your attention in these short lectures. But researchers have proved the fact that the antioxidant supplements like vitamin A, C, E, selenium, magnesium, they protect the body cells by neutralizing the free radicals and the atomic fragments that can cause cell destruction in the body. As a normal routine process, as we get older, our cells degenerate and they are destroyed, and by taking the antioxidants, they neutralize those free radicals. Furthermore, scientists have also proved the fact that the vitamin E supplement in elderly lowers the risk of heart attack, stroke, and Alzheimer's disease. Now, exercise is very important in all stages of life. Light up your life, get regular medical checkups as suggested by your physician. When I talk about the exercise, everybody doesn't need to go to the health places and do strenuous exercise. One of the very good exercise for all ages is a walking. Walking stimulates the cardiovascular system. And then there is another one, physical fitness. Follow the physical fitness with everyday activity in life. Keep moving from one end to another. Even if somebody is not working, they can still mobilize themselves by moving, go outdoor, take a walk and things like that. And then medical checkup, like I mentioned previously, is very important. The bright side of aging also includes, last but the least, laughter. Laughter is the best medicine to improve your mood when you are feeling down. How? What happens when you laugh? The heart and lungs are stimulated when you laugh because the amount of oxygen in your blood is increased due to the deep breathing. You laugh, there is a deep breathing, you inhale more oxygen. Furthermore, the heart beats faster, the blood pressure rises temporarily, followed by a drop of blood pressure, and there is a relaxation of skeletal muscle. Additionally, when you laugh, there is an exercise of facial muscles, and hence it prevents the wrinkles from our face. And lastly, but not the least, be cheerful, happy and think positive. Remember the saying, since April shower brings May flower and the winter blast bring spring joys. And this is the bright side of aging and summer safety precaution tips, as well as precaution tips for our senior citizens that I have prepared for all of you. And this is the part 1, and the segment 2 will come sometimes late fall and winter. And my second segment of the lecture will include winter related depressions, protection against the winters, and lot more. I am also going to talk about the polypharmacy issue, which is like some of us being on different kind of medication which we won't be needing. So I like to thank all of you for listening to my lecture, and have a very safe and a wonderful healthy life. Thank you again.